Um, how does the Parents Place of Maryland help to alleviate challenges parents and families of kids with disabilities face?
Yeah, so Parents Place is the Parent Training Information Center and the Health Information Center for the state of Maryland. So what that means is if families are having a hard time navigating either special education or the healthcare world, our staff is able to help them do that. So our parent educators here at PPMD kind of help provide that support for families and guidance to make sure that they are able to navigate those systems and advocate for their child. So our goal is to empower parents so that they can navigate whether it be special education and navigate an IEP process, navigate a 504 process, navigate healthcare. We connect them to resources, we do some training, and then we provide that one-to-one assistance so that they know what their options are and what their rights are through those processes.
And when did you first learn about the Parents Place?
So the Parents Place specifically, I connected with them the moment I moved out here. So I come from a parent training and information center background. I worked for the same organization for the state of Missouri prior to moving out here. And the way I came across PTIs in general was through my own kiddo. So when my now 12-year-old, when he was 3, when he received his autism diagnosis, was new to that world, didn't know how to navigate it, didn't know where to start, needing to get him an IEP and supports at school. And I actually went to a training in the state of Missouri that their PTI put on, and they were giving out information on how to best communicate with your kid's IEP team. I learned some really useful tools, got connected with that PTI. I actually ended up eventually volunteering with them. And wanting to give back to other parents in the community through that, and then eventually started working for them. So because I was working for a PTI in the state of Missouri, when my family made the decision to move out here to Maryland, I knew that every state had a PTI, so I knew Maryland had to have one. And so I did a search, found PPMD, reached out to them, got connected to a parent educator and said, hey, I know the federal law, I know what's going on in Missouri, but we're moving out to Maryland. Is there any information you can share with me for Maryland specifically? And Kristen, actually, who's here on staff, she's our director of early childhood programs. She's who helped me. And then she eventually said, hey, if you're working for a PTI, what are you doing when you get out here? And I said, well, I haven't figured that out yet. And so ended up sending them my resume and interviewing for a position when I got out here. So I've been working for PPMD since August of last year, so a year.
Okay, cool. And what do you think are the biggest issues that a new parent of a kid with disability may face?
I think just trying to navigate everything. It's very overwhelming when you get a new diagnosis, especially if it's something that you weren't expecting. And so learning what resources are out there, where to start, and how to navigate all of that. And then also feeling supported as you do that. It can feel kind of lonely at times, I know I was in a situation where all of my parent friends weren't having to navigate that. So it was a different scenario. It was new. Nobody had any advice or anything to give to me because they hadn't been through that. So needing to connect with other parents who are going through similar experiences, and then having to navigate all of the extra meetings, all of the extra therapies, all of the extra appointments, all of that.
Well, yeah. Thank you for talking.
Yeah.
Okay. So tell me a little bit about yourself and how you learned about the Parents Place of Maryland.
Okay, thank you so much for inviting me to be a part of your project. I am Marlo Lemon. I am Co-Deputy Director of Training and Strategic Programs here at the Parents Place of Maryland. PPMD has been around for over 30 years, and our mission is to empower parents and families of children with developmental delays and special health care needs. We service the whole state of Maryland. So even though we are a small but mighty group, we service from Allegheny County, almost in West Virginia, down to Ocean City, to just give you a frame work. We each of us either are parents or we have a special person in our life that we are committed to with the work of children and young people with disabilities. So we feel like when parents and families call in to us, we can say, I understand what you're going through.
Mm-hmm.
So that's a little bit about PPMD. We help parents find resources locally in their area. We help parents and families. A big part of it is get ready for IEP meetings, which is individualized education programs. Their meetings. We help parents and families just with asking questions. Our website, ppmd.org, talks a lot about, we have fact sheets, laws, sample templates for parents. And another thing that's great is the readability level is at fourth grade, because we do recognize that in Maryland, we have some underserved communities.
Yeah.
And we want to make sure that our resources fit and are open to everyone.
Nice.
So a little bit about me. I am the proud mom of 3. I call them my double blessing and little surprise. I have twin boys that are now 18, which I cannot believe, and I have a daughter who is 17. My 2 young men, one has dyslexia and the other one has autism. My son with autism, his name is Matthew. He is severely impacted or profoundly autistic. He's nonverbal. He gets every service from physical therapy, occupational therapy, speech therapy, cognitive behavioral therapy. Receptively, he understands a lot, but he doesn't talk.
Okay.
So we are working with activities of daily living, bathing, showering, clothing, things like that. So that's where he is right now at 18. So he is in the school system, and he will be in school until he's 21, until he ages out. When I first heard about the Parents Place of Maryland, probably when my boys were in infants and toddlers. So infants and toddlers is the birth to 5 portion, right before they get into school. It's called, they were in infants and toddlers, and they started in infants and toddlers when they were 17 months old. So we sort of noticed something was going on very early. So they were in infants and toddlers. And when I first heard about the Parents Place of Maryland, I actually just thought, oh, they're advocates. I don't need them right now. But realizing now we do so much more, and that we're not advocates. What we are is our goal. The parents are the longest standing people at that IEPT meeting. So it is our job. So no matter what team, what school the child goes to, it is our goal to empower parents so that they can go into meetings and feel equipped to advocate for their child. I think Maryland government could support children and families with disabilities. More funding and resources is always a plus needed. More education as it relates in professional development as it relates to teachers, strategies, programs within the school that specifically target our young people who might have dyslexia, reading and dyscalculia, reading, math issues. Specific targeted programs, because a lot of times you might hear, oh, this program or this evidence-based research is very expensive. But if the government stepped in with more funding, then schools wouldn't have to find available funding for some of these programs that will help children with disabilities. Insurance, so Maryland, as far as working on insurance, just statutes, it has gotten a lot better. Again, Matthew is 18. And when Matthew was first diagnosed, I very rarely use the term autism. I would say encephalopathy, which is a brain disorder, because encephalopathy got us covered under the insurance more so than the term autism. Now, 18 years later, things have changed. A lot of insurance companies have different programs that will help children on the spectrum, because the number, of course, has increased.
Yeah, and building off of that, have you seen any other significant changes or you've seen other people experience significant changes in how Maryland allows you to care for a child with disabilities?
I would say the insurance will be the biggest thing that I've seen. Uh, Financially, having a child with a disability is a stretch for so many families. Whether they're severely impacted or just have some behavior problems, a lot of times it takes one parent to be the manager. So the parent might have to either work part time or not work at all, and that puts a financial strain on the family. So, significant changes. There's more because of the increase in numbers, and I'm only speaking right now for autism.
Yeah.
But what we have learned is strategies for children with autism can work with so many other children with delays, sensory processing, and things like that. What I've noticed is with the increase in number and evidence based research, we can see different insurances covering um, ABA, more speech therapy and occupational therapy. That is the help. So that is, I have seen that increase over the years.
Um, so, like you said, as the number of kids with autism increase, like the availability of programs and help for them also increases. But what about like kids who don't have a disability that's so well known?
Very good question. And that's when I say the best resource, honestly, and we are an organization that works with children with all abilities, let me say that. The best resources are other parents and families. And that's what I love about PPMD, because even though your sister has a rare genetic condition, we have actually, we just partnered with, and I don't want to get the name of the organization wrong, so I won't say it, but doing genetics. And on our website, we have different videos with parents and families who have children with rare genetic diseases. So the one thing I would say is get connected with other families. Yes, it might be 125, but what's great now, a spotlight of COVID is virtual.
Yeah.
And if you can, why not connect with the other 124 families? See if there's, asking doctors a little bit more about, okay, this is what my sister, where's a network that can help us? Because that's how you grow. That's how you grow in knowledge and information, be it Facebook, social media, videos. But I think that when you connect with other parents and families, then that really increases your knowledge base.
What do you think are the biggest issues you face or see others face from being the parent or guardian of a child with disabilities?
Oof. I think sometimes there's so many, but you and I talked a little bit earlier about, and I hate to say parent, I would say parent guilt, because having siblings, Matthew is not my only child. It's finding enough time to help and support everyone in the household. It's finances. We have a saying here at PPMD, put your mask on first, that we, got directly from the airlines. And what that means is, as caregivers, it's difficult sometimes to take care of everyone. So if we don't put our mask on first, and we have wonderful videos on self-care even for parents. But if we don't take care of ourselves, it's hard to take care of our young people or children with disabilities.
Yeah.
So the largest issue I would say will be finances, because again, my boys are 18. By trade, I am an educator. I'm a teacher and professional developer. I stopped working full time when right after Matthew was diagnosed. So I would say about 3. Well, he was diagnosed at 2. Started therapy at 17 months, but I stopped working full time when he was 3, going into a program because it was, no. And I am just within 3 years ago working back full time.
Mm.
So it was a large gap. So
Yeah.
financially, my husband always says we went from 2 substantial incomes down to 1 with 3 dependents because they're only 17 months apart.
Yeah.
So I think financially for a family, because you can't just get a job. Yes, I could be a contractor and making a lot of money, but you need the health insurance.
Yes.
So it's like a vicious cycle. So I would say the biggest thing or the largest issues would be finances, having systems in place, whether it's insurance. Early on, when you don't know all the lingo, again, you when you talk to the insurance company, you have to know, what habilitative services are. If your plan only has 60 visits per plan year, what is 60 visits is not going to do anything when you have a child that's significantly impacted with anything.
Yeah.
The cost of co-pays for specialists. At one time, Matthew was going to a place, and the specialist he went 4 days a week. Well, if a copay and our copay has steadily increased. When we first started, it may have been $15, finishing out at $30. Well, $30 4 times a week is a lot
Yeah.
when you are raising another family. So I would say it's finances, and it's keeping your, mental health and like families just together to be able to prosper. Not graduating enough teachers in special education, and I know like finding individual therapists to work with our children sometimes can be really difficult, because not only do they need to understand the child, but they need to understand the different ability challenges that they might have.
How does the Parents Place help support parents through these challenges that you just discussed?
Great question again. We have coffee and again, we feel like other parents are the best resources. I mean, we hold coffee and conversations monthly, twice a month actually. We have a middle and high school group, and I'm looking up because my list is there. We have a behavior challenges group, a birth to kindergarten group, elementary, and we have a Spanish speaking group. So anybody across the state, any family can join our groups. And when they're joining groups, it could be a parent if your parent wanted to join and, talk about not the rare genetic condition. It could be another parent on the call and say, oh, this is what we've tried. We went to this place and that place, and have you tried this and this therapy? And we just found that they get resources from others. We share typically our monthly newsletter or topics that are going on. Any updates in the legislation sort of come through us. If we need parent input for legislation, that can sort of come through us. PPMD is Maryland Training. It's the PTI, which is Maryland Training and Information Center. So we try to be the information hub for parents and families.
Okay.
So we have coffee and conversations to share ideas, share frustrations, get resources, and they can also meet new friends.
Yeah.
So within those groups that I'm in, we have a morning group and an evening group, because we want to make ourselves accessible for parents and families. So once a month in the evening, once a month during the day, anyone can join. Go to our website, all of the information is there.
Well, thank you so much for telling me all this and agreeing to be interviewed.
You're quite welcome.
Yes, thank you.